Omicron cases climbing in North Idaho means we're that much closer to seeing crisis standards of care once again. Cases in the past month have jumped.
Just a month ago, the state deactivated crisis standards of care for the Panhandle, but that doesn't mean they're out of the woods yet. Rania Kaur is in North Idaho tonight with just how close we are to that crisis.
Just a few weeks. That's how long it's been since crisis standards of care have been deactivated in North Idaho.
I think the crisis standard of care largely has to do with the availability of resources at the hospital. So it really just depends on what our hospital has the capacity to deal with.
And it may be on the horizon. Last month, North Idaho had an 8% positivity rate. Today, that number has jumped to about 45%.
The trigger point that will drive us into crisis standard of care, it's about 490 cases on average that we're charting. So we're currently at about 300 that we're charting right now.
Dr. Anthony Rahel-Crest is the Chief Clinical Officer for Heritage Health. He says COVID-19 is already stressing hospitals and testing sites.
We're trying to keep our testing sites here in North Idaho open, but that requires staff too, and with the increase in volume of people needing testing and the staffing issue, that makes it hard to keep our testing sites open.
He says they're trying to keep people out of the hospital, and the best way to do that is for people to receive care early on.
We have a number of therapeutics that we can try to utilize in the outpatient setting to keep people from getting hospitalized and keep people from getting complications from COVID.
Because Karen Yao with the Panhandle Health District says we may be closer than we think.
And there are probably a lot of people out there that are not reporting to us, so we're not charting that number. So there could be, we might be a lot closer to the 490 than we really are seeing.
In North Idaho tonight, I'm Rania Kaur for News Now.